Okay, I think we can go ahead and get started. And then if people come in, we can continue admitting people. So let me share my screen. There we go. All right. So hi, everybody. Thank you for joining us today for this session on writing effective policy memos organized by the Journal of Science Policy and Governance as part of the NSPN Symposium, Science Policy for Racial Justice. My name is Adriana Bankston. I'm currently the Chief Outreach Officer for the Journal of Science Policy and Governance. I'll be moderating this session. And you can follow me on Twitter at Adriana Bankston, and JSPG is on Twitter at SciPol Journal. This session is centered around the 2020 Policy Memo Competition special issue published in collaboration with the National Science Policy Network. And you can check out the issue at the link below. Now I'd like to introduce the 2020 Memo Competition winners. The first place winner is Gabrielle Delima. Gabrielle is a fourth-year graduate student in the microbiology and molecular genetics program at Emory University. And her policy memo is entitled Lowering Preventable Maternal Deaths in Rural Georgia. In second place, we have Kyla Mace, a graduate student in the pharmacology graduate group at the University of Pennsylvania. Her memo is entitled Decriminalize Drug Checking Technologies in Pennsylvania to Prevent Overdose Deaths. And the third place winner is Hsain, who is a graduate researcher and NSF fellow in the Material Science and Engineering Department at NC State. And her memo focuses on paid family leave to strengthen the STEM workforce. So congratulations to all of you. And our speakers today will discuss their publications in JSPG, break down the structure of a memo, and offer some tips for policy writing. Afterwards, we'll do a little bit of practice writing in breakout rooms. And then we'll also share a handout with you after today's session with more resources. For logistics, so just like to remind you that this session is being recorded, and you can ask your questions in the chat box. We encourage you to follow us on Twitter and tweet about the session. JSPG is on Twitter at SciPol Journal. NSPN is on Twitter at SciPol Network. You can also use the hashtag JSPG events, as well as NSPN 2020 and SciPol Symposium for the event today. Now I would like to just give you a little background about JSPG before we move on to the writing specifically. So JSPG is an internationally recognized open access and peer-reviewed research publication, as well as a nonprofit. We're managed by and for students, policy fellows, and early career scholars from all academic and professional backgrounds. But we're more than just a journal. We provide an independent platform for the next generation of STEM and policy leaders and elevate their voices in policy. Through publishing in JSPG, authors gain credibility in science policy and can leverage their writing for policy engagement, as well as participate in debate and discourse in science technology policy. Our mission is to help students and early career scholars bolster their research and writing credentials in science and technology policy. We encourage them to engage in and contribute to the policymaking process at all levels of government, including local, state, federal levels, as well as globally. And we contribute to the professional growth of our authors by helping them write for a diverse set of audiences. In addition to publications, we actively promote published work via social media or global mailing lists, as well as individual and organizational outreach and other channels, including a new podcast. As you can see here, JSPG publishes in a variety of formats. This includes memos and op-eds, policy analyses, and others. And articles published in JSPG cover every corner of science and technology policy. You can see a list of the topics here. This includes, just to name a few, artificial intelligence, STEM education and workforce, science communication, the government, university, industry interfaces, and others. You can check out, find more on our website. And some of the ways in which JSPG elevates the voices of our early career authors in the policy is through events and also our podcast, as I mentioned. Here you can see an issue that we published earlier this year with the United Nations Major Group for Children and Youth, UNGCY, around equitable technology. We had also a webinar where I had a nice discussion between young scientists and leaders in the field. We also organized webinars around other topics, such as, you can see the one here we did with the AAAS Science and Technology Policy Fellowships earlier this year, around leveraging JSPG and STPF to advance your career in science policy. And you can find our webinar recordings on our YouTube channel. We also have a podcast, as I mentioned, called SciPol Soundbites. So we interview authors about their publications, and all three of our winners today will be featured on an episode. And then here you can see one of the episodes with the authors published from our issue with UNGCY, Fair and Soab, which you can find on YouTube and SoundCloud. And we also do training. So I've been part of a policy memo session organized by NSPN earlier this year, and we partnered with UC Irvine on an online certificate program in science policy and advocacy this summer and fall. So now I would like to spend a few minutes asking our authors to comment a little bit about their experience in publishing in JSPG. Personally, for me, being involved with JSPG has been really satisfying in terms of professional development. And I've been really had the opportunity to interact with authors as well through these events that I organized. So I'm gonna stop sharing now and let our authors talk a little bit about their publishing experience. Let's start with Alex.
Yeah, so I really enjoyed the process of publishing through JSPG. I found the editorial staff to be very professional and insightful. Actually, our editor was a UK citizen, so he had some insightful remarks about parental leave policies and how they are in Europe. And then he recommended that we look into some more European studies about paid parental leave. So that was a meaningful contribution from the editor. And yeah, I just highly encourage publishing through JSPG. They're a great team and they really want you to be successful.
Great, thank you for that. And Kyla?
Yeah, I second everything Alex said. Our editor was really accessible and provided a lot of great and helpful feedback for our memo and really made it a better piece of writing. And yeah, highly recommend publishing with JSPG. I thought it was a really enjoyable and enriching experience.
Right. And Gabrielle?
Yeah, so I second what Alex and Kyla have said already. Working with the editor was really easy and intuitive. It was also very helpful in that, you know, we may be more used to writing like scientific and technical pieces of writing, so a memo is a little bit different. And so the editing comments and feedback were really helpful so that the final product was polished and really clear and easy to understand. I would definitely publish with them again.
Great, thanks for that. So you can reach out to them for more questions. So we'll continue with the presentation now to switch over to Kyla, who will talk to us about principles and tips for policy writing.
Sure. So like Gabrielle mentioned, a policy memo is pretty different from a piece of scientific writing. It has a very specific goal, which is to provide analysis and recommendations for a specific audience regarding a specific problem. And so in kind of the real world, you'd probably be employed by someone who would be like, hey, we need some advice on how to approach this particular problem. Can you write up a policy memo on this topic that you may not know a ton about? And so you're having to like synthesize a lot of information into a pretty short piece of writing to tell your audience what exactly you think they should do. And so some qualities of a policy memo are they're evidence-based, so they're based in data and research. They're actionable, feasible, and targeted. So whoever's getting your memo should be able to do what you're asking them to do, and your ask should be something that is possible to happen. And they're concise and to the point. So there's not a lot of fluff. It should be easy to read, and so yeah, not a lot of jargon, which I can get into the next slide. So some basic tips for policy memo writing. I have on the right a screenshot of one of the early edits of our memo, which kind of illustrates just how much editing and just every single sentence got really picked apart, because every single word in your memo should serve a purpose. Like, there shouldn't be any extra adjectives or adverbs or clauses. Everything should be exactly as it needs to be, nothing extra. And they should be tailored to your audience. So it depends on if you're writing to your representatives or to like a federal organization, you would word things differently. We were writing to our representatives who probably don't know a ton about the science of drug use and of drug checking technologies. And also, it depends on your audience. BA is pretty conservative. The drug policy field is a little controversial. And so the way that we would word things to argue about this issue internally in terms of bodily autonomy and safety may not be as convincing to our representatives, and you have to word it in terms of health and autonomy to really get your point across. Your policy memo should be skimmable, so it's really likely that the person reading it is reading it like on their way to your meeting in the 5 minutes before they meet with you. So you should be able to read like the first and last sentence of every paragraph in your memo and get your point across. And with that, there should also be limited jargon and acronyms. Again, just make it really easy for someone to read. If they're getting frustrated after the first paragraph, you're not going to be very convincing. And then in terms of publishing with JSPG, the policy memos need to be under 2,000 words or about 4 pages. And like I keep saying, after reading your memo, your target audience should know exactly what you want them to do. So you shouldn't read it and be like, oh, this is a really cool idea, but what they're asking for, I don't really have the power to do. Or this is a really great, it's really convincing. I get that the problem is important, but I don't know what they want me to do. Like, it should be super, super clear, which Alex and Gabrielle are going to get into.
Great, thanks, Kyla. So next we'll have Alex talk a little bit about more considerations for policy memo writing and the structure of a memo.
Sure. So I summarized my advice into the 3 no's, and I think Kyla and Gabriella have already touched upon this. But first and foremost, it's important to know who your audience is. Consider if your issue is a federal, state, or a local issue, and don't discount your local authorities and your own representatives and how they can take action to combat the issue. Secondly, it's equally important to know who you are as an individual. So as an individual, you represent a consortium of different societies and groups. You are also a constituent, and so your representatives are being held accountable to what you want them to do in some sense. So you can always enter a congressional office as a constituent first and foremost, but you can also leverage your connections in your group associations, such as NSPN, AAAS, ACS, or whatever professional society you're in. And then lastly, it's valuable to know your timing. So what is the current political climate? What is on people's minds? What is the social consciousness at the time? And in order to make your issue more timely, it's important to tie in to whatever social issue people are talking about and make it relevant so that that urgency gets across and so people know that they need to take action right now. So we're just going to cover the structure of a policy memo very briefly here. So policy memos can look a variety of different ways. They can be briefers or follow-ups to a specific question. They can be a status update, or they can also propose a very strong recommendation. So generally, in the academic sense, or the policy memos that you'll see in JSPG, they typically have the format of an executive summary, background, options analysis, and final recommendation. So the executive summary is like a mini memo within your memo. It has all of the important points and your final recommendation. The background, this is what creates the context for your issue. It should be very succinct and concise. You should highlight strong statistics and leverage expertise. But really, you should keep this as brief as possible without missing any context for understanding your issue. And then the options analysis, this is where you're going to do that cost benefits, political feasibility assessment, dollar amount, and this is really where you're going to use those analytical skills. And then finally, you do want to have a very strong recommendation. You don't want any obscurity in this final recommendation. You want people to know exactly what you're standing for in this part. And then the last thing I'll say is that it's very important to be concise and clear and compelling so you can learn this bottom line up first method or bluff. And it definitely is the hardest part of memo writing because as scientists, we are taught to write very effectively, but also we can sometimes be verbose. So I'd like to use this example. I don't know if I have any Frankenstein fans here, but you know, Mary Shelley versus Percy Shelley, and their versions of Frankenstein looked very different. Percy liked to use a lot of, you know, flowery language, such as neither of us possess the slightest preeminence over the other. But for memo writing, it's really great to be like Mary and just say, we were all equal instead.
Great, thanks, Alex. So we'll move on to Gabrielle, who will walk us through her policy winning memo and illustrate a few writing concepts. Go ahead.
Yeah, so just like Alex had mentioned already, the executive summary is going to be at the top of your policy memo, and it's going to, as it states, summarize the memo. And it needs to be even more concise and impactful than your already short 2,000-word memo, right? And so because it's a summary, it's usually easier to write it last once you've written the body of your work. But again, it's presented first because if the person who's getting your memo has never read it before, or maybe they read it and then want to remember the important points, they can look at the executive summary and get all that information. So you want to make sure you state the issue, why should they care, and your actual policy recommendation. So what's the best way to solve this issue? So in our example, we state the issue: Georgia's maternal mortality rate is one of the highest in the US. There's some studies that show that a big issue is lack of access to available providers. We give our specific policy recommendation. In this case, we say we propose an amendment to the Georgia Legal Code. And you can end your policy memo with your actual policy recommendation, or you can add maybe a sentence or so at the end that talks about what the positive outcome would be. But again, this section should be short and have all the relevant information. Next slide. The next section would be the background, or how you introduce the issue. So you usually start off with the statement of issue. You can call it the statement of issue or state what the issue is. That's a personal preference. But you want to make sure, again, you go over what's the issue and why should they care, but in greater detail than in the summary. And so for our example, we note that the US has a higher mortality rate, maternal mortality rate than in other developed nations, but more specifically, Georgia's is one of the highest in the country. We go into further detail about the issue that in rural counties in Georgia, those women are 50% more likely to experience maternal mortality, and the fact that in many of these rural counties, they don't have labor and delivery units or even obstetrician, gynecologists, or OBGYNs. So from this, they can see this is the issue, this is why it's important for Georgia. Next section. The next part that you'll go over are the current policies and laws. So you have to be very aware of what's already been done. Has anything been done to address the issue in your area? And more importantly, why isn't that enough? So if there are already things being done, it's a lot easier to not do any more work, right? So you have to convince them that what you're proposing to do will solve the issue better than what's currently been done. And so our example, we had note that Georgia has attempted to address the issue. They have this committee that found that there was lack of access to care being an issue. We note that they have approached financial approaches via tax credits, loan repayments, millions of dollars to birthing hospitals. There's even a pending bill that's being proposed to try and address the issue. But again, this isn't enough. So we have a specific statement saying that these efforts are not reaching the in-need areas to the extent that the problem demands, that these incentive programs aren't enough, and that women are still dying. So this sets the tone for the policy proposals that you are going to show next. And one other thing that you want to include in this background, you can include a figure anywhere in the paper. You tend to see them more in the beginning, but you need to, if you are going to include a figure, it has to A, support your issue and do it robustly, and also needs to be easy to interpret. So depending on who your policy memo is going to, you don't know what their educational background is or their familiarity with the issue. And so, you know, when you're reading scientific papers, you can have graphs that can have all kinds of things, you know, different labels and legends and axes, and you have to really understand the techniques being used to understand what the graph is telling you. That is not the graph that you want to use in the memo. You want to use something that's going to be really easy for people to understand readily if they don't have the background knowledge. So for our example, we're looking at the Georgia's rural doctor shortage. We just have a county level map of the state of Georgia, and the shading lets you know what they're lacking in those counties, whether it's a pediatrician, OBGYN, or if they don't have a doctor at all. So if they were to look at this figure, you can just easily see that there's a lot of areas in Georgia, a lot of counties in Georgia that don't have the physicians needed for maternal health care. Okay. And so next we'll go into the actual, the meat and potatoes of the memo, which are your policy options. So when you're thinking about what policies you're going to propose, as was mentioned earlier, you really need to remember who your audience is. Maybe they're conservative or more liberal. It'll really determine what policy options you think that you want to propose and how you word them. And so typically there are 2 to 3 policy options, and again, they need to be actionable, and these can be novel, something that you came up with on your own, or it can be from existing policy. So maybe in another county or another state, they already have these policies in action or being proposed that you want to adopt in wherever you're addressing your memo to. And so with these policy options, you want to organize them. I tend to approach it in a best, okay, worst kind of fashion. Your best option is going to be the one that you actually want them to, that you're going to recommend and you want them to take up. And so this is either going to be the most robust way to solve the problem, or maybe the one that you think is most likely to pass in whatever capacity that this policy will be brought up. You have your okay option, which will maybe address the issue a little bit, but either maybe is less likely to pass, or maybe, you know, it's not going to actually address the issue to the full extent. And then you have your worst option, which is typically inaction. So what would happen if you actually did nothing at all? And so you want to word these policies so that when the person reading your memo reads it, they also get an idea of this, I think, is the best, okay, or the worst option as well. And so to walk through our policy memo, the first thing you want to do is state the policy. You want to give supporting information and also how it will actually solve the issue. So we note that Georgia is the most restrictive for certified nurse midwives. It requires this written agreement between physicians and CNMs that restricts their practicing authority. But we also note that these CNMs actually have training in order to do midwifery, labor delivery, and many primary care functions. And so we are proposing specifically to amend this specific Georgia code to eliminate this requirement. And then how will this solve the issue? Well, these CNMs who are already trained in maternal care throughout pregnancy will be able to manage these low-risk patients more independently than they would have before. And so the next section, you'll also want to talk about, you want to list the pros and the cons, or the advantages or disadvantages of your policy option. And so you really want to think critically, again, remembering who your audience is and what they're likely to see as a pro or a con. And remember that there's always a downside. So there's no option that's going to be absolutely perfect and have no downside. For example, with maternal mortality, maybe we would have suggested, hey, we give all women health care, right? Free healthcare, they should be able to get the doctors that they need, right? But then the downside is that that would be incredibly expensive compared to other options. So you want to keep that in mind. For our example, we listed the advantages for the CNMs being able to practice to a fuller potential utilizing their skills. It results in lower risk and lower patient costs. It's because you're going to see a nurse instead of a physician. You also increase access to care by utilizing the workforce that's already there. The downside would be that you still need to recruit these people to rural areas where there's a shortage, and that they might work longer hours or might have higher costs for hospitals, for example. And so again, you want to list all of the pros and cons realistically when you're writing these sections. And then the very last thing that you write at the end would be your policy recommendation. Next slide. Yep. And this is usually very short and brief. You want to state the recommended policy option. Again, we recommend this option to do this thing. You also want to include the outcome. In our case, it'll increase the availability of healthcare providers statewide, reduce patient financial burden. And then you want to finish strong with some kind of sentence or statement that really wraps up why this is important and why your policy recommendation would be the best outcome. So we note that this expanded scope of practice isn't present in most southern states, but are in other states. And so Georgia has the opportunity to be this leader in the South that'll create a better environment for Georgia's mothers and babies. So it kind of leaves them with a feel good and wanting to actually push forward with your recommendation.
Great, thanks, Gabrielle. That was really helpful. So we're gonna do a little practice now in breakout rooms for about 10 minutes or so related to the question of should the federal government mandate the COVID-19 vaccine and how this mandate might affect underrepresented minorities who may distrust the medical establishment. So given that we have a short time, we'll just focus on pros and cons. We'll have each of our panelists in one room, and then I'm just gonna let Alex tell you a little more while I set this up.
Sure. So yeah, so you're going to work in a small group. And like we said, we're going to focus on that pros and cons aspect. So maybe consider what are the benefits, what are the disadvantages of a mandated federal vaccine, and also consider what scale this issue could be resolved on. Should it be resolved at a federal level, or should it be more state or local? And then finally, think about some incentives or policy changes that you can recommend. So again, it doesn't have to be, you know, that mandate, or it might actually be a different type of policy change that you want to suggest. So think about all of these factors, and like Adriana said, we're going to be in the breakout rooms with you all, so we'll kind of help you and guide you through this process as you need.
Great, and then we have a Google Doc as well. Let me share this. Where we'll just have you write, take notes, and then if you can designate a note taker to recap as well when we'll come back. So I think we're ready to go. Okay, I think everyone is back. So we're just gonna spend the last few minutes doing a little recap from the breakouts and then close. If I can ask Kyla to facilitate this section.
Sure, my group can go first. I forget who said they would do the recap. I think it may have been Morgan.
Yes, yeah. Let me gather my thoughts real quick. I think initially we could see a lot of cons with having a widespread federal mandate, thinking about equity in terms of how do you enforce this, recognizing just access to healthcare and some of these touch points. We started dialing down into different local and sublocal communities such as public schools, universities, as well as thinking about where is a vaccine really going to be helpful and needed. So crowded urban centers, thinking about places that we've heard about like meatpacking facilities, nursing homes, all that kind of stuff. So thinking along the lines of equity, thinking about like access to healthcare in different places, thinking about what level it might be important at, and also just thinking about, you know, what is our goal here? You know, trying to reach some sort of herd immunity and trying to say how can we make it potentially more targeted and tapping into different touch points and places of community, relationship building, and trust. That's kind of an overview of where we were.
Cool. And how about Alex's group?
Hey folks, I'm Paige. So I was in Alex's group. And we talked about a lot about the cons, of course, like most groups, like inaccessibility for marginalized communities, especially those in more rural areas that lack those hospitals. It can also push people in another direction due to like having more disdain for the government due to past experiences. So if you mandate it, it should come with education about what the vaccines entail, how it can benefit you, as opposed to just being like, hey, you have to take this. And this is, you know, it should come with more information for people who may not have that. Also, we talked about cost. So, you know, Medicare, Medicaid, Biden care, you know, will it cover the expenses, you know, for the vaccine? Like, will it be free and accessible for these communities? But also some of our pros, you know, if the federal government could streamline the distribution, it could come at like a set price, limiting to ensure vaccine accessibility to marginalized communities. And we could also see states varying in response to COVID-19, which in turn, we suggest putting like some restrictions on travel if, you know, you don't get vaccinated. But also in some incentives like, okay, you get to go back to work or you get to send your kids back to school if you, you know, have this vaccine. We also talked about certain states having pushback like Florida and Georgia. So it would have to come with some federal push for states like this. So if they did mandate it. And then more funding for people with pre-existing conditions. So maybe setting up a plan where you get more benefits if you do get the vaccine, or you get more benefits if you have a pre-existing condition and then you get the vaccine and so on. So yeah, those were some of our ideas.
Very cool. And Gabrielle's group?
Hi, I'm Jacob. So the cons we discussed and pros were pretty similar. We were really concerned at the beginning about the feasibility of a federal mandate. And so we talked a lot about how could we implement it in a way that isn't just a broad action, like saying kids who want to go to public school need to take the vaccine. We were concerned about logistics, about how could it be paid for? Do we have enough? How are we going to maintain the cold chains to areas that are more rural and underserved? We had a lot of logistical questions, but we saw some pros of trying to implement mandates in different ways rather than a broad federal approach, because mandates for that are more focused, like for healthcare workers, would probably be easier to pass, especially if you already have buy-in from the group, and could really ease the burden on our healthcare system, our education system, and on people who are having their lives burdened by the virus existing. Yeah, I think that's most of the pros and cons we hit.
Cool. So yeah, I think that doing the sort of pro and con list, as a lot of y'all experienced, it really makes you think not just about your ask, but also your audience. So like, who am I going to ask to do this? Is it going to be at the federal level, the local level, the state level? And doing that pro and con list really helps you flesh that out.
Great, thanks Kyla, thanks everybody. That sounds like it was a really great conversation. So hopefully you got something out of that little practice. So I'm just going to close us out with a call to action. So please submit your policy research to JSPG by November 15th. The next deadline will be in the spring. Subscribe to our newsletter. You can find the link here. And then we're also on Twitter, Facebook, and Instagram at SciPol Journal. And we also like to invite you to subscribe to our YouTube and SoundCloud, where we post our podcast episodes as well as webinar recordings on YouTube. And that's it. So thank you for joining us again, and enjoy the rest of your day.
Thanks, everyone.
Thank you all so much. This is a great workshop.
Thank you so much. It was really good.